When I first joined RWJBarnabas Health, I joined because of the intent to have Rutgers Cancer Institute being the only NCI-designated comprehensive cancer center in the state of New Jersey offer an umbrella approach to cancer care. In the field of surgical oncology, the cases can be complex, and we are just so lucky and fortunate that within RWJBarnabas Health and the Rutgers Cancer Institute, we have a team of surgical oncologists that focus on thoracic surgery, liver, pancreas, gastric surgery, and other more complex malignancies such as peritoneal surface diseases in a team-based approach within surgical oncology. One would expect, and what we have really seen, is an improvement in patient outcomes and an improvement in quality of care. We look at our service line of surgical oncologists as one large program, and those surgeons come together and they work with each other in the operating room. They work with each other outside the operating room. They share the responsibility of caring for patients with complex diseases. An innovation that seems the most promising right now is the investment of the healthcare sector into artificial intelligence. Here at the Rutgers Cancer Institute and RWJBarnabas Health, we were a leader in the country in adopting an artificial intelligence software to identify patients living at risk for the development of pancreatic cancer or patients living at risk for the development of lung cancer, identifying those patients, contacting those patients, and getting them into the appropriate surveillance care pathways. In addition, that particular software stays with the patient. It's AI, it lives in the background of the medical record, and it continues to listen for changes. If a patient were to have change, automatically that patient is pulled back into the appropriate care team. It speaks volumes to our dedication to quality, and it speaks volumes to our mission of leading the way to prevent cancers and not just treat cancers when they form. What I have been inspired by, in particular pancreatic cancer, is the fact that many patients with certain diagnoses come to us having already lost hope. And as a surgical oncologist focused in that field, I am driven by the ability to try to wage hope where many have found it lost. In our practice daily, we are focused on the extension of life, or at times even curative therapies. We know that cancer care does not travel well. Therefore, a main mission of our healthcare system is to offer the highest quality of care within 20 minutes from a patient's home. We want to make our communities healthier in the state of New Jersey.